10,000 jobs about to be gutted from the Department of Health and Human Services. CBS News reporter Alex Tin watching this announcement. Alex, what's getting cut and why?
Yeah, so it's important to put this announcement in context. They are announcing today 10,000 layoffs at HHS, the Department of Health and Human Services. Some of the biggest cuts are going to happen at the Food and Drug Administration. That's the agency that's responsible for approving new drugs and doing food safety inspections. Some of the other agencies that are also going to see thousands of employees let go include the Centers for Disease Control and Prevention, as well as the National Institutes of Health. The amount of cuts, that 10,000 number of workers that are being cut, that comes after thousands of workers have already left the department. By the department's estimation, that is going to put them at 62,000 workers after all these cuts and departures are done as part of a larger reorganization. And again, just to put that in context, that's down from more than 90,000 workers at the department at the end of the Biden administration. That's 33% less workers at the department.
Yeah, this is not many weeks after the confirmation of RFK Jr. being at the wheel of HHS. He's also announced plans to create the so-called AHA. What do we know about that?
That's right. Yeah, it's the Administration for a Healthy America, AHA. It's a brand new agency that's designed to essentially group together a lot of the priorities that we've heard Secretary Kennedy talk about since before he was secretary, back when he was just on the campaign trail supporting then candidate and now President Trump. Some of the biggest things that are going to be under this umbrella span everything from the Substance Abuse and Mental Health Services Administration all the way over to the work that's going on right now at HHS to update federal nutrition guidelines. That's those dietary guidelines that school lunch programs and Head Start programs and all kinds of other federal agencies and federal grant funding rely on to come up with how to feed children and families. So again, all of these are being grouped together in this new agency that's going to be essentially separate and apart from a lot of the other agencies that we know about, like NIH, CDC, and FDA.
Alex, I have to ask you, because all of this is playing out against the backdrop of what is a national news story where Health and Human Services really is concerned, and that's a outbreak in more than one cuts. Will any of those cuts affect the outreach where vaccination rates are concerned, or the outreach where trying to stamp down this measles outbreak is concerned?
Yeah, the short answer is we just don't know yet. You know, a lot of the details of these cuts have not been disclosed to agency health officials. You know, some of the people that I speak with within the CDC, for example, tell me that managers just weren't consulted. They have no idea where these cuts are going to happen. Of course, we're going to find out where these cuts are going to happen soon. Both unions as well as agency health officials say they've been told that the first notices of the federal employees who will be cut as a result of this change are going to start as soon as tomorrow. And so when the dust settles, we're going to get a better sense of where exactly within the CDC and these other health agencies these cuts are going to come from. For what it's worth, the Trump administration and Kennedy's team say that the majority of their cuts are focused on eliminating duplication, what they say is essentially administrative functions, communications functions, and other kinds of, offices within these agencies that they say are essentially duplicated and will be able to be consolidated and, quote, streamlined once these agencies are combined.
Well, we know when we get the fine details, you will have it. Nice to talk to you, Alex. You have a great day there in our nation's capital.